All right. All right. And I'm going to turn it over to you now, Wendy.
Okay, great. Hello, everyone. My name is Wendy Ayers. I am the program director for the respiratory therapy program. And I just want to talk a little bit about our program. So what is a respiratory therapist? Well, we are a healthcare professional. We are bedside practitioners. We work at the bedside with physicians and nurses and the nursing assistants. And what do? We diagnose, we treat, and we educate patients. Where are some of the areas that we can work? We work in hospitals, emergency rooms. We can work in pulmonary clinics. We can work in home care, education, private enterprise, research, organ procurement, air and ground transport, ECMO, which is extracorporeal membrane oxygenation. These are just some of the areas and the majority of the areas that we work in. The majority of respiratory therapists, of course, just like most nurses, we work in the hospital. But those other areas that you can branch out into as you move through your career, if that's something that you wanted to do. How do we assess and diagnose patients? We use pulmonary function testing. We use arterial blood gases. We use acute assessment skills. We use sleep studies, chest x-rays. We listen to the lungs. And the main thing is having really good assessment skills and how to identify what's going on with your patient so that you can come up with a treatment plan. And so how do we come up with that treatment plan? Well, we use a lot of sophisticated devices. We are huge into working with equipment and applying that equipment with patients. We work with mechanical ventilators, medication delivery, maintaining airways. Of course, we're part of the CPR team. We educate. One of our biggest jobs is educating people or educating our patients. We do arterial blood gas samplings. That's just some of the things that we do. That is certainly not everything that we do, but that is sort of an overview of what we do on a day-to-day basis. I'll probably say one of the best things that I've always liked about being a respiratory therapist is my day is never the same. I've been a respiratory therapist for 32 years. And when you go into work, your day, you never know how your day is going to be. You may have a nice calm day. You may have a day that you think you're going to go in and have a calm day, and that's going to change. That can change very quickly in a minute. Where you have somebody that cardiac arrest, or you have a patient that starts going bad. So you never know how your day is going to be. And that's kind of the exciting part about it. It's not anything that's routine. It's fast moving, and it's just really a joy to work with the patients. So I always say that to future students that want to come through the program, that if you like working with people and taking care of people, then this is the area for you, because that is what we do. So looking at a couple of statistics, if we look at the area of COPD, which is chronic obstructive pulmonary disease, this is the largest category of patients that we deal with. These are patients with chronic lung disease. Those are broken down into chronic bronchitis or emphysema. Some of you may have heard of emphysema, and some of you may have actually had bronchitis. There are about 9 there that have chronic bronchitis. And that's for the ages 18 years of age and older. That's about 3.6% of the population. Emphysema is approximately about 2 million adults, and that's of patients that are 18 years of older. Most patients that develop emphysema, of course, are former smokers, but they also have a form of emphysema that is genetic. So it's from a gene mutation. and I got these statistics off of the American Lung Association. Those are just two of the disease processes that we work with. Another one, of course, is asthma. There are 25 million Americans that have asthma. This equals about 1 in every 13 person has asthma. As Americans, that's about 8% of adults and 7% of children. These are about 20 million of those people are 18 years of age and older, which means about 5 million are under the age of 18. Asthma is more common in adult women than in men. It is the leading chronic disease in children. So some of you that are on here tonight may have children that have asthma. You may have asthma, and that's what brought you to this presentation. Currently, there are about 5.1 million children under the age of 18 that have asthma. And believe it or not, asthma is actually more common in boys than in girls. And a lot of our career or our profession rotates around patients with asthma as well. What's like a day in the life of a respiratory therapist? Well, we deliver medications, we give medications, we do patient assessments, we educate our patients, we manage mechanical ventilators, we may have to do CPR, diagnostic testing, we round with the doctors and the rest of the care team that's taking care of the patient, and we develop care plans for the day, how we're going to address this patient's needs for the day. So our program is a 4-semester, 2-year plus 1 summer curriculum. What are the prerequisites for a program? You have to have 3 years of high school English, 2 years of high school mathematics. At least one of those years has to be algebra. You have to have 1 year of high school laboratory science. You need to have a GPA of 2.5 in order to get into our program. So the way it works is you need to see a CVCC counselor, and what they do is they will get you started on getting your transcripts and going over what you need to do in order to get into the program. They will send us send me a referral. Once I get a referral, I will send you an application. And then once you get the application, you'll complete the application and send it back to me. And at that point, I will call you and we will set up an interview. And we will bring you in for an interview. And then after we complete the interview, we'll take all of our applicants and we'll look at all the applicants we've received, and we will let you know usually within a week to 2 weeks after your interview as to whether you're getting accepted into the program or not. One of the things is you have to maintain a C average or better while you're in the program, and that includes anatomy and physiology, biology 141 and 142. So what can you expect after you graduate? Well, after you graduate, you have to take a 2-part national exam from the National Bureau for Respiratory Care. That is a 2-part exam. The first part of it is a written exam. The second part of that is a clinical simulation exam. Once you pass both of those, you earn your credentials, your registered respiratory therapy credentials. Once you earn your credentials, you have to get a license in whatever state that you're going to work in. And once you get that license, you can go to work. In the state of Virginia, the license is renewed every 2 years, and you have to have so many continuing education credits in order to renew your license every 2 years. So what is the income for our profession? Right now, the median salary in the United States is $62,810, and that was from 2020. The best paid 25 percentile is $75,950. And the lowest paid in our profession is $54,170, but the median is $62,810 per year. If you look on the Labor Bureau statistics, the respiratory therapy salary overall is a 7.2 out of 10 points. It is the number 6 job, best job in healthcare. It is the number 16 best job in the top 100 jobs in the United States. And also, speaking of the Bureau of Labor Statistics, right now, as of 2020 through 2030, we have a 23% growth in the next 10 years. That is well above average. The average is usually less than 10% on a job. We're at 23%. We need respiratory therapists desperately. I will just tell you that. Hospitals, I get contacted from hospitals many times during the week asking to let our graduates know, or our students getting ready to graduate, they're looking for therapists. We have 100% job placement every year that I've been doing this for 12 years in this position. We've had 100% job placement every year. We never have an issue with getting our therapist jobs. If you want to know more, I highly suggest that you go to our national Congress, or our professional agency, which is the AARC.org/career. They have a lot of information. They have some videos you can watch. So again, that is the www.aarc.org/career. And for those of you that came in late, my name is Wendy Ayers. I'm the program director for the respiratory therapy program. And on my presentation, I also had my email address and my phone number from my office. But since I could not share that with you, my email address is Ayers, AYERSW @centralvirginia.edu.
And I put it in the chat, Wendy.
Oh, you did? Okay,
Yes,
great.
yeah, and the AARC.org.
Okay, great. Thank you.
Yeah.
And that's all I had. I'm open for questions.
Thank you, Wendy. Great. So I'm just going to touch on a couple things, and then we can open it up to more questions if that works for you all. So thank you so much, Wendy, for that presentation. You did fantastic, even without your PowerPoint. So that was amazing. And as I said before, my name is Ashley. I'm a counselor here at CVCC. I'm just going to kind of touch base on the steps that you'll want to take if you're interested in applying to the program. The first is going to be to apply to CVCC. You can do that online, and you can do it from our homepage. And then, as Wendy said, you'll want to go ahead and send us your transcript. So we'll need your high school transcripts, and if you've attended any other college or university, we'll need you to send those as well. And we'll need the official of all those. And if you're a dual enrolled student by chance, you do not need to worry about applying. You're already a current student at CVCC. You'll just want to go ahead and send your final high school transcript, so we have that on file, and you want to send all those to our admissions and records office. Once you become a CVCC student, you're assigned a navigator and a counselor. And your navigator is going to assist you with completing the direct enrollment survey that you are sent once you submit your application to the college. And that survey helps us determine your math and English placement. And your navigator will also help you log into your MyCVCC. They'll show you how to access Student Center, Canvas. They'll also help with the FAFSA, which is the free application for federal student aid. And they will also help enroll you in your first semester of your classes at CVCC. And then your counselors who will work with you after your first semester, and together you'll work on establishing an academic plan. We'll talk about strategies on getting you ready to apply to the respiratory therapy program, and your ultimate long-term goal. And as Ms. Ayers shared, this program is selective. And so students do need to complete the referral, which she spoke about. So that's something that you'll do with your counselor. And we'll send that referral to Ms. Ayers by the referral deadline, which traditionally is April 15th, but this year it's been extended to June 30th. And as she mentioned, there are certain prerequisites that you'll need to complete. So you'll meet with your counselor and we'll verify that you've met those prerequisites, which are the 2 years of math in high school, 3 years of English, and then 1 year of a lab science. And then we are also looking for a GPA of 2.5 before you can be referred. And then once you're referred, she's going to send you that application. You'll fill it out, send it back to her, and then she'll invite you in for an interview. And then students will find out by May or even sooner after the interview if they've been accepted or not into the program. And I know I meet with a lot of students that get nervous about the interview process. So we do have a career counselor, career advisor. Her name is Sarah Jarrett. And she's happy to meet with you to kind of go through some mock interviews to get more prepared for the interview with Ms. Ayers. So I'll put her name in the chat too if you want to reach out to her. She's a great resource. And so that was all I was going to kind of talk about this evening. So if we would welcome any questions you have, you can put them in the chat. You can unmute yourself and introduce yourself and ask your question. We'd love to hear them. And we're thankful that that you all could join us this evening. So any questions from anybody?
There really is no reason to be nervous about the interview.
Yeah.
Really, it's not a stringent interview process. It's really for us to get to meet you, tell you a little bit about the program, find out a little bit about you. It's not anything to get nervous, I promise.
I just put Sarah's contact information in the chat.
Okay.
Does anybody have any questions at all? Any at all? Feel free, you can put them in the chat or you can ask them. Oh, okay. So we do have a question, Wendy. D.H. Walker is asking, is there an age limit?
There is not an age limit. You have to be 18 in order to sit for your boards once you graduate. We have had in the past, we had 2 students that came to us as 16. They were homeschooled. They graduated from high school when they were 16, and they actually went through the program. But when they graduated, they were both 18. So like I said, you do have to be 18 to sit for our boards because you can't work as a respiratory therapist in a hospital unless you're at least 18.
Great question. Anybody else?
Don't be shy. Well, if we don't have any other questions, I guess we will close out for the evening, but please, I put Wendy's contact information in the chat. I'll also put my contact information in the chat. So please feel free to reach out to either one of us if you have any additional questions. We are here to help. And we are so glad that you joined us this evening. And like I said, this will be on our website if you want to come back and rewatch the presentation. So Thank
you
everybody
all
for joining us.
us.
Bye.
Bye. Couple. Magda, do you have any questions? I don't know if okay, well, maybe Magda has I don't know what's happened, but I'm going to go ahead and end it.
No, I don't have questions.
Oh, okay.
Okay, thank you.
Thank you. All right. Okay. All right, Wendy. Well, I guess this is goodbye then. Thank you so much.
Sure thing.
Okay.
I appreciate it.
All right, you did great. You did great without your presentation. And Magda pointed out that the reason why is that the organizer has to enable screen share, and I wasn't the organizer, so I messaged Michelle, but she's
okay.
so yeah. So we know that for the future. But you did great. You don't even need your PowerPoint. So
Well,
and I learned a lot. So thank you.
All right.
All right.
Well, thanks, Ashley.
Okay. Thank you.
All right,
Bye.
talk to you later.
Bye.
Bye.